I'm your host, Nicole Margaret, and thank you for keeping it HEALTHWING. Today we are here to answer your questions. In case your question is not answered about diabetes, please leave your comment down here and let us answer it. So, Daktari, habari ya masiku?
Mzuri sana.
So you can tell these people your name and introduce yourself.
Oh yeah, my name is Chris Musioka.
Yeah, so we begin with the basics. We begin with what is diabetes?
Oh yeah, diabetes is a disease in which body's ability to produce or to respond to the hormone insulin is impaired, resulting to abnormal absorption of carbohydrates. So that is, I think, the simple definition of diabetes.
Okay. What really causes diabetes?
Diabetes can be caused by many things. One, diabetes can be caused by obesity. You know what is obesity? You become overweight, then after overweight, someone comes obese. We have classification of obese. We have obese class 1, obese class 3, obese class 2, and obese class 3. So one cause of diabetic as a disease is caused by obesity. Another one, it is inactive lifestyle. Someone who has been inactive and he or she is maybe obese, so inactivity may also cause diabetes. Number 3, diabetes can be caused by genetic inheritance. Genetic inheritance is where a parent, mother or father had a diabetes. So we say if a mother or a father has a diabetes, 1 or 2 of his children may become diabetes as they grow up because of genetic inheritance. Number 4, another cause of diabetes, we call it autoimmune reaction. Yeah, this one is especially mostly for the children. So autoimmune reaction is whereby the body attacks itself. It attacks itself, the body, and it is where the pancreas. There are cells that they are in the pancreas. They are called the beta cells. So when they get attacked, the pancreas is unable to produce the hormone insulin. So that is what we call the autoimmune reaction. So those are most causes of this disease called diabetic. A kid may be born diabetic. So, and we have some types of diabetic. For those of teens and kids, we call it diabetic type 1. So, and it's the one that I've called it autoimmune reaction, where the body attacks itself. Okay. So, a baby can be diabetic. Yeah, type 1.
And small babies who have not been born with diabetes can still get diabetes when they're still young.
Yeah, you can get diabetic at any age, the type 1 diabetic. And I've said that the cause of type 1 diabetes is that just the body attacks itself. That I've called this autoimmune reaction. So type 1 diabetes is a chronic condition in which the pancreas produces little or no insulin. Mm-hmm. So when it happens, so for diabetic type 1, there is no way you can prevent it. You cannot say, I will not do this so that I cannot get diabetic type 1. So it just comes. Not like the type 2. Type 2 you can prevent it. But for type 1, nothing you can do. Yeah.
What are the symptoms that you begin to see for you to know that you are diabetic?
The symptoms is 1, you have frequent urination. Number 2, thirst. You are taking a lot of water after every 10 minutes. Number 3 is blurred vision. You have been seeing well, but now you cannot read well. Number 3 is tiredness. You feel like your body has no energy. Another symptoms of diabetic is I think those are the common symptoms of someone who is suffering from diabetic.
How can you prevent these lifestyle issues of diabetes?
The only prevention is doing exercise,
Okay.
and being aware of whatever you are eating. You should not overeat or consume more calories than your body needs. That is one thing that you should know. That you should not take in more calories than you can burn them. So if you do so, you'll gain weight and you'll become overweight. Even apart from getting diabetic, you'll get other lifestyle diseases like heart attack, like kidney failure, all those things. So the only prevention is to do exercise, be active. As we say that at least 30 minutes of exercise in the morning or in the evening. Or there are those that they go to gyms in the morning. There are those that they go for the gyms after work. So exercise, good diet can be one of the way of preventing of such a disease.
When you say good diet, what does this mean?
When I say good diet, I don't mean expensive foods that we get them from the supermarkets. It's just to know the food groups. First, we we have carbohydrates, we have proteins, we have fat, we have vegetables, and we have what else? They should be 5. We carbohydrates, proteins, fat, vegetables, and fruits. So those are the 5 food groups that one should know and should balance them. The only food that is high in kilocalories is carbohydrates, and it is the main cause, the only food that may cause diabetic reason, because it has something we call glycemic index of carbohydrates is very high. So you should balance them. It's good now to visit a nutritionist or dietitians to be able to explain to you how you can go through, you can go about the diet so that you can balance them and you can distribute them well, and even the frequency, the number that you are eating throughout the day, depending on the work that you are doing. A health officer like me and a person who is in Mjengo, we cannot take the same amount of meal, because someone who is in Mjengo is more active than like a health worker like me. So mtu wa Mjengo, he should take food that is rich in kilocalories than a teacher, than a receptionist, because he is working, he is burning more calories. So the more you burn calories, the more you get in the calories. So the problem of this is where you are taking a lot of calories in, but you are not burning them out. When you fail to burn them out, the weight increases, and such things happens into your system. Do exercise. If you are obese, overweight, you don't know what to do, visit any hospital that has nutritionist, and let the nutritionist take your weight, take your height, and then calculate your BMI. And if you are overweight or obese and would like to lose weight, the nutritionist or dietitian will be able to advise you on what to do. And if you suspect that you have got those symptoms of frequent urination, thirst, tiredness, blurred vision, all those things, it's important to also to be checked your blood sugar level. So it's very important. So it's good, even if you are healthy, to know the range of your blood sugars. It's advisable to take it, we call it random blood sugar and fasting blood sugar, to determine whether your sugars are high, are low, or they are normal. So it's very important. So if you have such symptoms, please visit a hospital, get checked your blood sugar levels, and visit a nutritionist for further explanation. Thank you.
Coach Potatoing, like being there, you're not doing anything. In short, laziness that is having baptismal name. So today we get to know that laziness can cost you your health. You can be diabetic because you do not have work to do, because you're sitting down, not doing exercise, not working. You should make sure your calories are used. That was a part 1 for diabetes. Just to know what is diabetes, how we can prevent it. But now I know that some of you are past that stage. You are now diabetic or have one with diabetes, and you need to know more about diabetes and the prevention, and not the prevention but the cure, the medication, and even the dieting. I'm here because you are. Keep subscribing because I love you all.